Western Mass News received an anonymous tip from a Baystate Health employee saying hospital workers will not be receiving their annual pay increase amid the hospital's financial struggles. And tonight, Western Mass News reporter Maria Wilson is live for us in studio after she spoke with an employee about the impact this will have on her. Maria.
Well, Chris, I sat down with one employee who has worked at Baystate Health for several years now, and tonight she is frustrated and disappointed, saying that the hospital's financial struggles will have real consequences on her own.
I don't think anybody is excited to be waking up and going to work knowing that they're working so hard for really nothing.
Many Baystate Health employees shocked and disappointed by a letter they received on Tuesday. Hospital employees were notified their annual raises will be delayed until further notice. Western Mass News obtained a copy of that letter sent to Baystate Health employees that reads, "We have made the difficult decision to delay annual pay increases typically effective in April." The hospital blaming financial challenges, including a $40 million budget deficit. Among them, growing operational expenses that continue to outpace revenues, payment rates from insurance companies that do not cover the cost of care, and continued staffing shortages. We spoke with one Baystate Health employee who spoke to us on the condition of anonymity.
I'm a single mother. I'm struggling.
She says she already works a second job and was counting on that raise to help pay the bills.
Seeing that letter, knowing that I just worked so hard this last year and that it really didn't matter. I do truly care about the patients that I help every day, so it's not going to change how I work, but it is extremely disappointing and, makes me feel a little stuck.
And tonight, she has questions on how the hospital found itself in this situation.
If we're so busy and we can't accommodate enough people in a quick enough time, you would think there would be plenty of revenue coming in.
But one local economics professor says when it comes to the healthcare industry, unfortunately, it's not too surprising.
Hospitals are having difficulty because of costs that they're incurring that they can't pass along. For many, many reasons, people in those sectors, which are a lot of people, are suffering still the effects of inflation.
But for now, the Baystate Health worker says she and her colleagues remain disheartened and upset.
For everybody that got this news and, cried a little bit, my heart is with them, and I hope it gets better for us all.